Breast augmentation is an operation that we do as an outpatient to enhance the appearance of a woman's breast. Augmentation means we're enhancing, we're enlarging, we're making them bigger. And it's really one of the most popular operations we do today. And I think the popularity has increased as a result of the fact that silicone implants have now come back on the market. We usually do this as an outpatient. The procedure takes maybe an hour and a half. We usually do it under IV sedation, so the patient really feels no pain. I sort of tell people you're in la-la land. You're back there, we have an IV, we give you some medication. And many times people wake up and say, when are you going to start? And I say, your operation's over. There basically are three types of incisions that are utilized in breast augmentation. The first incision is the axillary incision, which I don't subscribe to. The second one is what we call a periareolar incision. The nipperareolar complex has a certain size, and then we make an incision, sort of a semicircle along the inferior portion of the areolar complex. And the third, and the one that I use 99% of the time, is the inframammary incision, which I think is the best. And by the way, has been shown to have the lowest incidence of mark encapsulation, so it's the incision I prefer most of all. Basically, there are two types of implants, general categories it is. The first implant is saline, which is a silastic shell, and inside of that shell is saline or salt water. The second one is the silicone gel implant. The new silicone gel implant, somebody utilized the term gummy bear. And when I compare the implants today from what we used 30 years ago, there's a tremendous difference. If I were to take a silicone implant today and cut it in half, you have two pieces. And that's where the gummy bear came in. Like if you took a gummy bear and cut it in half, you got two pieces. You come back 6 months later, two pieces. Silicone implants, in my experience, give a softer, more natural appearance and feel to the breast. I think that many patients that do have saline, especially if they have very little breast tissue, will feel the rippling of the saline, and it's not a natural feel. So I basically tell patients, the less breast tissue you have, the more important silicone becomes. Many times women will have had saline implants, they come in for an exchange, and one of the things they don't like about saline is there's rippling, waviness, unevenness, and you can actually sometimes palpate the saline implant through the thin tissue. So the less tissue a woman has, the more important silicone becomes. And without a doubt, it's far superior to saline. The length or how long an implant will last is a tough question to answer. It's not cut and dry, but on average, we usually tell patients about 10 years. But in my experience, and I've been doing it now for 33 years, many times a woman will come in, have breast implants put in, then she'll come back in 6, 7 years after having 2 or 3 children, and she needs to have them lifted. Or she may come in because she's had 2 or 3 children, her breasts have become smaller. Now she needs a larger implant. And so we take the one they had and put in a large one. But on average, about 10 years. But I've got many patients in my practice that have had implants in 25 years before we exchange them. So with most implants, I would say 10 years is an average.